Work incentives make it easier for people with disabilities to work and still receive their benefits. Welcome to Ask an MS Expert. I'm John Strum, your moderator and host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Today, I'll be asking our expert the questions you want answered. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS Navigators will be online throughout today's live program, answering your questions and connecting you to resources. Work incentives are special rules within the Social Security disability programs that allow people to continue working without losing their cash payments and Medicaid or Medicare healthcare coverage. Beth Scott, the Director of Case Management at the Patient Advocate Foundation, joins us today to discuss work incentives within disability programs that can benefit people living with MS who are able to work and want to continue working. Welcome, Beth. Thanks for being with us today.
Thank you so much. Nice to meet you today, John.
I hope you can start us off by explaining what SSDI and SSI are.
So SSDI and SSI, Social Security Disability Insurance is the acronym SSDI, and SSI is Social Security Income. So two different programs. Social Security Disability Insurance, or the best way to remember that is for people that have worked a significant amount and have paid into the system, and through that paying into the system through FICA is how you end up getting your SSDI payments once you're eligible for that. And SSI is typically for patients that are either disabled at birth or they have become disabled, but they really haven't put enough income or work into the system. So SSDI, just to break that down, supports workers who have become disabled, but they're no longer able to work. And people that apply for SSI, that's a needs-based program for people who have limited income and resources.
Well, I heard you just mention when you become eligible. So let's talk about that for a minute. How does someone go about being approved for either of these programs?
So you can apply online through SSA. You can go online and apply. You can create a password and apply online through the Social Security Administration. You can also, if you don't have the way to do that, you can also apply by telephone. You can also make an in-person appointment at your local Social Security office. Some people prefer to do that because that way they can bring their own documents, because you will need medical records. You will need your work history. People that are applying for SSI will also need to bring their income documentation. There is a daily function report, so you'll need to be able to give the worker that information, and also any kind of contact information that you may have for your doctors and your clinics.
Can you explain what work incentives are within these two Social Security disability programs?
So there are work incentives that help people that have either SSI or SSDI be able to keep their benefits, so be able to keep their income. So one of those incentives for both SSI and SSDI is a ticket to work program. We can go into that a little bit later. There's also trial work periods for people that have SSDI. And then there's also a plan to achieve self-support for people that have SSI. So I can go into that a little bit further, but if you'd like me to go into each one of those, I can do that as well.
Well, I think we're going to get to all of those.
Okay.
But before we do, I know one of the things I mentioned when I introduced you was that what these programs allow someone to do is to go ahead and go to work, but still continue receiving Medicare and Medicaid coverage. So I think it's worth taking a moment to explain the difference there. It sometimes gets confusing. The two words sound very similar. What is
Yes.
the difference between Medicare and Medicaid?
Okay, so Medicaid is an assistance program that's funded federally at the state level. And it's a needs-based program, which means that both income and assets are counted that determines the patient's eligibility. Where Medicare is a federal insurance program, it's not run at the state level, typically for patients that are over 65, but also patients that are receiving SSDI are eligible for Medicare at the 24th month mark. Both of those, they're able to keep the Medicaid and Medicare through these incentive programs. So they are able to work and able to keep those insurances that are, needed for patients that have disabilities.
So, if someone living with MS is receiving SSDI or SSI benefits, what is it that they have to keep in mind about their Medicare Part A and Part B?
So again, they will, once that 24-month mark comes up under SSDI and they're already on SSDI, they will get Medicare Part A and B. Medicare Part B will have a premium that will be deducted from their Social Security disability check that they get each month. I believe that amount right now is $185. But what to remember is they don't have to take Part B if they already have another insurance, but they will pay a premium penalty later if they don't take that Part B at that time. If they don't have I'm trying to think the best word to use. If they don't have coverage, then they will have to pay I can't talk. A They will have to pay something later. So Medicare provides ongoing healthcare coverage for these people, even if they are going back to work, and you are able to keep your benefits like SSDI and SSI. So it's not immediately affected if they do one of these work incentives. In fact, there's several protections in place for that, while people are, challenging that and testing their work. They are able to keep their Medicare.
Well, in a minute, I want to drill down to some of these specific work incentives. But first, I'm hoping you can tell us what the Red Book is and how someone living with MS can use it to understand work incentives.
So the Red Book is a reference for people that are, you might want to look at it now, even before you even have any questions about that. But it's about employment related provisions of the Social Security Disability Insurance and Supplemental Security Income Program. So if you're living with MS, one of the things in this Red Book is understanding the options of how working might affect your benefits, what supports are out there, um, how you can plan to return to work. So you can use some of the incentives that we've talked about, Ticket to Work, Pass. You can protect your health coverage and learning how to keep your Medicaid and Medicare. That's all in the Red Book. And then you're able to also track your progress. So know when to report the earnings and know what to expect when your income does change. And you can find that, again, online at SSA, ssa.gov.redbook or /redbook is where you find it.
Sounds like a very useful resource. You know, I,
Definitely.
I want to get to some of the specific work incentives for SSI in a minute, but let's start with the work incentives for people who are on SSDI. Can you tell me the difference between the trial work period, excuse me, and the extended period of eligibility in SSDI, and maybe explain the benefits of both of these incentives?
Okay, so the trial work period allows you to test your ability to work without losing your SSDI benefits. And it's the duration of that is 9 months, and that's not necessarily consecutive 9 months. It's a rolling 60 months, so 5 years. Um, you will still be able to receive your SSDI full benefits regardless of how much you earned during that time. And so the goal of that is to encourage you to continue working without losing your benefits immediately. The extended period of eligibility provides a safety net after the trial work period ends. So, and it's good for 36 months. So both benefits are, they're both risk-free. They both let you trial working and while keeping your full benefits. The extended period of eligibility, continues eligibility for benefits, even if your income fluctuates. So if you make more than you should make, more substantial gainful activity, then you do it 1 month. So you're able to fluctuate each month.
We heard from Armand, who tells us his MS symptoms forced him out of the workforce. He's been receiving SSDI benefits for a few years now, but he says his MS has been stable and he's interested in exploring virtual or part-time employment opportunities. And Armand is wondering how the Ticket to Work program could benefit him.
Okay. So first he would need to, he would get in contact with the Social Security Disability or through SSA. It's not a physical ticket. So he's automatically enrolled and he can use this, he can use it at any time. His ticket will be assigned to a vocational rehab or VR agency, and employment network. And these can be public or private organizations that help with job placement. They also help him develop a work plan with his chosen provider that outlines his employment goals and services he'll receive. He'll start getting support like career counseling, job search assistance, resume and interview preparation, training, education, ongoing support. And during this time, he will be protected, or he will not be subject to continuing disability reviews at that time.
Jean says she was a stay-at-home mom before being diagnosed with MS, and she's interested in finding employment, but doesn't really know where to start. Could you explain how the Work Incentives Planning and Assistance Program could be helpful to Jean?
Yes, so this is a program, it's a free service that's funded by Social Security Administration. And they offered personalized counseling to patients with disabilities that receive SSDI or SSI that may be interested in working. So they offer one-on-one counseling, workplace, work incentive guidance, customized planning. So she'll receive a customized plan that considers her MS and goals and her financial needs. And if she moves her benefits to employment, they also navigate her transition. And so she'll be able to gain confidence that she can work without immediately losing her benefits or her healthcare coverage.
Let's talk about work incentives for people who are receiving SSI benefits. We heard from Lupe, who tells us she's living with MS. She started getting her medical bills paid through a program through her church, and she's worried that assistance will negatively impact her SSI. Could you explain how Lupe might benefit from the earned income exclusion?
Yes, so the earned income exclusion is a rule that helps people that have SSI or people that get SSI to keep more of their benefits. So if her church is paying her medical bills directly, that's not really considered earned income. That would fall under in-kind support and maintenance or unearned income. So unearned. She didn't earn it, they're paying it for her. So depending on how the payments are made. So if the church pays the medical bill provider directly, the SSA might not count at all. If the church gives her the money to pay the bill, then they may consider that unearned income. That may impact her SSI payment. So it's really important to find out, how they're paying that. She should still try to report that to the SSA and explain to them how that they're paying the bill. And then she should ask them whether or not that support qualifies as a charitable gift or excluded income. And then she could also speak to a WIPA counselor so they could give her advice on that.
Can you tell us how Section 1619B of the Social Security Act, or continued Medicaid eligibility, might affect someone living with MS who wants to go to work?
Okay. So it allows SSI recipients to keep their Medicaid coverage, even if their earnings become too high to receive the SSI cash payment. This is as long as they were eligible for the cash payment for at least once a month. They still meet disability requirements. They still meet non-disability SSI requirements like income and resource limits. they need Medicaid to work and have earnings below the state threshold for Medicaid recipients. And this matters to people that have MS because, of course, people with MS have ongoing medical care. Fear of losing their Medicaid is a barrier to their employment. They need to be able to work, but they also need to be able to see a physician when they need to. So that kind of removes the fear, ensures that Medicaid continues even if her SSI payments stop. So it kind of gives people the freedom to try working without risking losing their benefits.
Emily says she's on SSI and she plans to return to school to finish her degree. How could the Plan to Achieve Self-Support program help support Emily's financial investment in her education?
So this, it's PASS is the acronym for that. So that is a work incentive that allows people that are on SSI to set aside some income. So the income to pay for expenses like job goals, finishing a degree, starting a business, job training. They're able to set that aside. They can also get support from SSI that have past specialists that can help her write and manage that plan, and that will not affect her benefits at all. So she's able to keep all of that and also try to put some things aside, maybe for school expenses, whatever she may need.
Bradley is self-employed, and as his MS has progressed, he's had to purchase specialized equipment, even modify his car to continue working. How could work incentive programs benefit Bradley's situation?
So there is something called impairment related work expenses. So these are out-of-pocket expenses or services that are needed for work. They're related to his disability, and they're typically not reimbursed by another source, like specialized equipment, maybe keyboards, voice recognition services, vehicle modifications, hand controls. They can be deducted from his earnings when the SSA determines if he's engaged in substantial gainful activity. This means his SSA may count less of his income, helping him keep his SSDI benefits longer.
Well, I have one more acronym to ask you about.
Okay.
We've been talking about federal programs, but I'm hoping you'll take a moment to explain state disability insurance, or SDI, and how that differs from SSDI or SSI. And actually, I'll make it a two-part question. Are there work incentive programs like the programs we've been discussing for people receiving SDI benefits?
Okay. So state disability or state-run insurance is a state program that provides short-term wage replacement to eligible workers who are temporarily unable to work. So we're thinking like people that are to a non-work related illness. So injury, pregnancy. It's not available in all states. So California, New Jersey, New York, Rhode Island, Hawaii, Puerto Rico are the states that offer that. It is their eligibility is based on the recent work and payroll contributions. It's temporary, and it's funded through state payroll taxes. It does not have formal federal work incentives like SSDI and SSI. But if a condition becomes long term, like MS, a person may apply for SSDI and SSI, and once approved, they can also access federal work incentives like the ones we've talked about. The difference in SSI, SSDI, and SSI is that SDI is short term, SSDI is long term, and SSI is run under financial need. And they can use this. I'm sorry.
Please go
I was
right
just
ahead.
saying,
No, please go right ahead.
they can use this time and income from the SSDI to stabilize their health plan for their long-term support. So they can use it up until they apply for the others.
Got it. When I introduced you, I mentioned that you were director of case management for the Patient Advocate Foundation. So I'm hoping you'll tell us what the Patient Advocate Foundation is all about and how it can help someone living with MS navigate work incentives and disability programs.
So PAF is a national nonprofit, and they help patients with chronic and debilitating illnesses. So if someone reached out to us, we would have a case manager assigned to their case, and they can help patients apply for Social Security disability income, SSI, or state disability programs. They help patients navigate Medicare, Medicaid, or private insurance. They also help them with marketplace plans. We help explain and help access work incentive programs. We also appeal insurance denials or benefit determinations. We also help with appeals to Social Security. We do that frequently. We also offer small grants depending upon the diagnosis, disease specific grants for transportation, housing, utility, depending upon the diagnosis. And we also provide educational resources.
Well, you've shared some really great and important information about work incentives and disability programs that could benefit someone who's living with MS. What would you say is the top takeaway that you'd like our viewers to remember and to use?
I think the top takeaway is that you can explore work and pursue your goals without immediately losing your disability benefits. Whether you're on SSI, SSDI, or programs like Ticket to Work or Pass, they're all there to support the journey to employment so that the people are able to do it at their own pace while protecting their stability.
Well, Beth, I'd like to thank you so much for being with us today.
Thank you so much. Nice being here.
Today's program survey has now been posted in the chat for your feedback. Please take a minute and complete it to help us create programs and topics with you in mind. Please be sure to visit the National MS Society's website for information and resources on MS, connection opportunities, and ways for you to get involved. You can also connect with an MS Navigator to receive personalized support by phone, email, or through the Society's website by chat. A recording of today's program will be posted on the MS Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. Finally, I'll invite you to join me each week on the Real Talk MS podcast, where we continue the conversation that we start here. You can find Real Talk MS on Apple Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. Thanks for joining us for Ask an MS Expert. We'll see you next week.